language scale is normal. So we use a language scale to do the assessment, whether the child's motor development is normal, whether the child's development is normal. A DQ scale will be done. So this is the difference between surveillance, screening, and assessment. Continuous monitoring is surveillance, cross-sectional monitoring is screening, and in-depth evaluation is called as assessment. Then two other terminology you should understand. One is developmental delay, the other is developmental disability. So delay, if you understand that there is something delay, a child which is supposed to walk, the neighboring child, the neighbor child or the sister's child who is able to walk without support at 1 year, and if this child is still sitting with support, then there is a delay in this child. So a delay can occur in any one of the following area: in understanding, that is cognition; in moving, that is motor; in communication, that is language, or hearing or seeing. Any one of these area there is a delay. This child is called as a developmental delay. If the delay is persistent, if you are not able to make the child come out of this delay, then it becomes a disability. If you have found out there is the child is delayed to walk, and you have done the intervention and you have corrected the child is better now. If you have not done the intervention and your intervention is not effective, and the child still at 8 years is having a different walk, then that comes their disability there. So you should understand the difference between developmental delay and disability. Three more terminology I have to introduce today. One is delay, the other is deviation, the third is regression. Delay means if the child is having some development, if you are expecting some development that is at 1 year, this development, and the child has not attained that development, but by 1 year, the child has only developed that 9 months development at 1 year, it is called as a delay. Deviation means which are all not part of the development. Something like a neologism. You must have heard the word called as neologism. Neologism means the child is putting some new words for her own. That is a deviation. Regression means, for example, if you have seen autistic children, they will be saying, சார் ஒரு வயசு வரைக்கும் இந்த சைல்டு பை பை சொல்லுவான், அம்மா அப்பா சொல்லுவான் சார், பார்த்தா சிரிப்பான் சார், இப்பதான் சார் எல்லாம் போயிடுச்சு அப்படிம்பாங்க. So that is called as regression. Language regression is there. Social regression is there. This is called as regression. I will say this classical example of a train which has started from Chennai. Instead of reaching New Delhi at 9 o'clock in the morning, if the train has reached only till Agra in the 9 o'clock, this train is in delay. Instead of going towards New Delhi, if the train has started from Chennai and going towards Mumbai, it is called as a deviation. The train has started from Chennai, it has gone up to Vijayawada, then now it is going towards Madurai. Now it is called as developmental regression. So these three words also you should understand for you to handle any case. So as I already told you, this autism is a classical example to understand delay and deviation. If the child is not supposed to develop an eye contact by 2 months, social smile by 2 months. If the child is not developing eye contact and social smile by 2 months, you are saying that the child is having a delay. As I already told you, echolalia is not a delay. Echolalia, if you are asking, do you want juice? Immediately the child will say only the last word, juice only. What is your name? Name. So that is called as echolalia. All these are new things which the child is doing, and these are called as developmental deviations. So having known these words, I am going to introduce only two more words also. Early stimulation, early intervention. Stimulation is something which is something before happens, you are doing something. That is called as stimulation. So if you are feeling that a newborn baby, a preterm baby, which is in the NICU for 15 to 20 days, may develop some developmental problem, you are stimulating the baby in all the domain. You are stimulating the motor system, you are stimulating the eye system, visual system, you are stimulating the hearing system. If you are stimulating this continuously, the baby is not supposed to go for developmental delay. This is called as stimulation. Intervention. If the baby has already developed the problem, you are intervening, then that is called as intervention. So I think you are very well now well versed with these terminologies. starting from developmental assessment, surveillance and surveillance, screening and assessment, delay, deviation and regression, delay and disability. So our aim should be treating delays and not seeing that this child is not going for a disability. Our aim should be early stimulation and see to that this child doesn't need an early intervention. In the early period itself, you have to intervene. So what is early intervention? So having note that this child has developed a developmental problem, early intervention you are going to provide is the process of providing specialized support and services for the infants and young children with the developmental delay. Already this child has developed a developmental delay and you are going to promote the development so that the child will have a well-being, because this is a child. This child needs has to be in the community participation. So you are going to train the child in all the ways, with your physiotherapy, with your occupational therapy, with your speech therapy, with your behavioral intervention, with your education, depending upon the age of the child, on the what age the child is and what you are going to do. You are going to do the therapy, right? So these are the various definitions for early intervention. I'm not going to go in detail, but finally, it is not a drug. It is not a vaccine. It is not a device. It is a group of therapists working together, solving problems and enhancing capability. That is the best answer which I can give for early intervention. Early stimulation. Early stimulation is the result of exposing toddlers and babies to any activity that boosts the development. So you have to boost the development of the baby, stimulating the child through normal developmental channel, and our aim is prevention of developmental delay. So once the delay has developed, what you are doing is an intervention. Before the delay has developed, you are stimulating the baby. That is called as stimulation. So coming to what are the ways you can do the early intervention? You can do prevention, you can do curative, you can do supportive, you can do remedial also. So the prevention is by neuroprotection, the cure is by neuroregeneration, treatment is by neuroplasticity, which I am going for come in fear. Coming to why there is an early intervention. Your senior people must not have seen this much cases of developmental problems. There may be few of your seniors will be there. Few of the developmental people who are working with the development will be there. They will be having few cases. Why? Why this number of cases have increased? Even you know that CDC is saying 1 in 59 children is having autism. 10 years back, before they were saying 1 in 1,000 children is having autism. Now they have reduced the number. 1 in 59 children is having autism. Because the pointers are, what I can say, the opportunities for development has reduced. At the same time, the risk factors for developmental delay are increased. So that is the reason why many developmental problems are coming. If you can take, most babies are born premature. Most babies need an NICU care. Because of this, babies being born of IVF and IUI, this assisted reproduction techniques, these babies are prone for developmental delays. Screen time is very important risk factor for this language delays. All these are risk factors. Opportunity, if you can take, previously you all will be in joint family, most of them will be supporting the baby. Now only the father and mother and the child are there. The mother has to go for work, father has to go for work. Some ayama will be taking care of the baby, who will give the mobile to the baby and she will sleep nicely in the daytime. So opportunities for development are coming down. At the same time, risk factors are increasing. So lot of developmental problems are coming nowadays. So benefits of early intervention, as I already told you, for the child, it will be gaining the physical development, language development, and the social skill development. For the family, it can easily manage the child and reduce the stress. Benefit for the society is also there. They can be for special institutions, care need not be there for these children. So as I already told you, you have to concentrate on the development in all these areas. physical development, cognitive, that is the understanding area, social and the emotional development, behavioral development. So if you are going to concentrate on all the domains of development, you are able to produce a child who is holistically fit for the society. So preventive. So preventive, when you come for prevention, you can say there are three modes of prevention. Primary prevention is there, secondary prevention is there, tertiary prevention is there. So primary prevention, before the developmental disability has appeared, if you are doing something, then that is called as a primary prevention. What you can do, you can prevent low birth weight baby, you can you can provide good perinatal care. So they are all primary prevention. Secondary prevention, what is that? Already the baby has some risk factors. Now you are stimulating the baby. Early stimulation you are doing and shortening its duration. So this is secondary prevention. Tertiary prevention, already the baby has developed a delay. Now you are intervening and further preventing the further disability of the child. This is called as tertiary prevention. So what are the candidates I can think to do this, to intervene? So there are the three categories of these people. One who have already developed the risk, they are called the established risk people. One who have the biological risk, that is genetic problem is there. So I am doing some intervention. And the environmental risk. This is the main important. So yeah, established risk include children with an established diagnosis of developmental delay. Biological risk by genetic factors, metabolic factor, endocrine factor like hypothyroidism is there, Down syndrome is there. All these children come under biological risk. Environmental risk, family is not supporting the baby. Extreme poverty is there. Parental education is very less. All these children come under this environmental risk. So this is the tabular column to show that which are the children who you want to treat, who will come to you for early intervention. Low birth weight babies, premature babies, babies with birth injuries, prenatal and natal injury, high risk mother. High risk mother means like mothers with high BP, high diabetic. All these babies are coming under biological risk and they need early intervention. Already babies with developmental delays, cerebral palsy, epilepsy children, autism children, mental disorders children, learning disability children, sensory impairment children, all these children will also come to you for early intervention. As I already told you, there is a group of children with environmental risk. They are from low socioeconomic status. Poor child-mother interaction is there. All these children also need early intervention. So I am not going to in this child. So what is the scientific basis? You should understand this word neuroplasticity. Whoever working in the field of early intervention and therapy should know about this neuroplasticity. Why I should always treat these children very early? Can I not treat these children by 7 years of age? Then also I can promote the development. No. So something called as neuroplastic. Neuro means nerve. Plastic means plasticity. So if you have some plastic, you can mold it into a mug, you can mold it into a tumbler, you can mold it into a toy, you can mold it into a bucket if it is very soft. If it has been already hard, you cannot do anything. So that is the neuroplasticity. The neuroplasticity refers to the moldable structure of the brain and nerves that results from changes in the neural pathways and synapses. So you are doing something for the brain and the brain is able to understand that. That is possible only in the first 2 years of life, which is called as the critical period. The mother will not understand this. The mother will think the child is good only and the child is playing very well and those things. But they will not understand the neuroplasticity. It is like a patient having a heart attack. If you immediately take the patient within 30 minutes to 1 hour to the hospital, you can save his heart. Likewise, if you intervene in the earliest, that is within the first 2 years of life, you are going to save the baby and you are going to make a productive child. So this will be having the maximum benefit. So the window of opportunity, the first 2 years is called the window of opportunity, the motor development, the visual development, and the language development. For the first 24 months, you have to intervene. For the within the next first 4 years, you have to intervene to develop social development, emotional development, thinking, thought process, and the intelligence. So this is the window of opportunity which we need. How this neuroplasticity? See, I am doing a therapy. I am doing physiotherapy. How this child's brain is learning? Can it? What is the method? What is the concept? Is there? There are two concepts which are being promoted. One is enhancement of existing connection and formation of new connection. Most of you have learned that in the brain, the smallest structure is the neuron. So in the neuron, we have connections called as synapses. So when the synapses are forming, only new and new changes and new activities the baby will develop. So as I already told you, when you are doing some therapy from outside, the neurons which have already died because some NICU toxicity, like some antibiotic in the NICU period, or some low oxygen in the NICU period, or hypoglycemia, low sugar in the NICU period, all these nerve connections are being enhanced because of your therapy, and the new connections are also being formed in the brain because of the therapy you are doing. So this is called as reverse reinforcement and enhancement of increased use of synapse in the existing pathways. So alternate pathways are also being developed, so when we do the therapy. So this is a slide. So increased afferent input. So you are doing some therapy, that nerve is taking some input to the brain. So new synapses evolve, leading to increased excitation. So that is the way new synapses are formed. See, you are learning. You are learning. This hand is you are learning, and your brain is being developed. Means stimulated, excited with the synapse development. Formation of new connection. For example, there may be few neurons which are very silent within the brain, very silent. When you do the therapy, these neurons get excited and there will be sprouting, new formation of the new pathways will be there. So have the confidence that if you are doing some therapy, some way, whatever may be the method of therapy for language or for motor or whatever may be for sensory, you are going to do some stimulation, and this is going to work by formation of the new connections and unmasking of the dormant pathways. Some few pathways may be dormant, they will not be active, and these pathways are stimulated, and new nerve tissue also gets sprouted. New formation of the sprouting of the new tissues are also developing, and this is the way by which your what I say, your developmental therapy is helping the baby. So where can this early intervention be given? So having seen that, who all the babies who need early intervention, how this early intervention is helping the baby, and now I am going to say where this therapy had been given. Home-based intervention. There are a lot of home-based programs because the mother is the best teacher for the child. You can teach the mother how to do the early stimulation. You can ask the mother to do some touch therapy. Every week, the mother can do some massage for the baby with oil. This is a very important massage and touch therapy. The mother can talk to the baby with her own language, that is called the parentese. So the parentese will stimulate the stimulation with language stimulation. All these are very important home-based stimulation activity. Center-based program, which we are all doing. Our therapists in the centers are doing this thing. Home comes center-based. Some program, because all the 6 days baby cannot come to the center. Few days the baby will come to the center. Few days the baby will be in the home where the therapy will be given. Coming to occupational therapy. So most we believe that physiotherapy is for large muscle and occupational therapy is for small muscle. Common belief is that OTs help people return to work following injury or illness. This is only one part of the problem. What they do, actually they help to self-care activity. So coming to children, what these people are doing, occupational therapists help in self-care of these children, and also help. So overall, if you see what are the skills which these occupational therapists do this with these children, they promote fine motor skills. What are these fine motor skills? Very important for fine motor skills means using the fingers, mainly using the fingers, and the finger mouth and the finger eye coordination. hand, mouth, and the hand-eye coordination. All these things are very, very important fine motor skills. We need, if you want to hold a pencil or a pen, we need a fine motor grip. If you want to write legibly, we need a fine motor grip. If you want to hold a comb and comb our hair, we need the good grasp. If we need to button our shirts properly, we need the fine motor grip. All these skills, if are absent in the child, will be imparted by the occupational therapist. Visual perception and visual motor skills, these things can be imparted by this occupational therapist. Play skills. What are the play skills? Lot and lot. The child, depending upon the age, have its own play skills. The child has to develop its own play skills. You must have heard solitary play, pretend play. There are various types of play. Solitary play, what is solitary play? The child plays on its own. That is solitary play. Pretend play, when should this come? At about 1 year to 1.5 years, the child should have a pretend play. What is that pretend play? With the doctor said the child should be able to play like a doctor at 2 years of age. Which a kitchen said the child should be able to do something. So this is called as pretend play. So if the pretend play is not there, so it is the role of our therapist to import these play skills in there. Sensory processing, which you all know, that I will be dealing in the next few slides. Self-care skill. Self-care skills is nothing but activities of daily living, which is ADL. What is ADL? We starting from when we get up in the morning, we brush our teeth, we do toileting, then change the dress, bathing, buttoning the shirts. All these are activities of daily life, which our children with developmental delay will be lacking. So these therapists who are working in the field of occupational therapy will be helping these children to develop these skills, or called the activities of daily living. So as I told you, fine motor skills using your hands and finger, opening a jar, shoelaces, buttoning, pencil, etc. Visual perceptual skills, as I already told you, visual perception is the brain intercepting what the eye see. Visual motor integration, which is very, very important when you want to draw a picture, do a puzzle, everything you want this visual motor integration. Play skills, as I already told you, creative play, you need play skills. All these are play skill toys, which are available with the therapist to import play skills, starting from a pegboard, squeeze toys, soft toy, tactile stimulation toys, rattles, depending upon the age of the child, a ball pool, all these, depending upon the age of the child, the therapist will be using to import play skills. Self-care skills, activities of daily living, including feeding, dressing, and toileting, can be imported by our therapist. Speech pathology, I'm not going into that speech pathologist part, because that is also needed in the early intervention part. Sensory processing, as I already told you, like motor, sensory is also very, very important. We have 5 senses. We all know, eyes, ears, nose, tongue, and our skin. All these are the external senses. The internal 2 senses are proprioception and vestibular. Proprioception, what is proprioception? Where we are, where I am standing, where is my body, to make you aware, that is called as proprioception. Vestibular, what is vestibular? I am jumping from a small stool to the floor. I am able to make me steady. That is because of your sense of vestibular sense. So all these sensory things, the 5 external senses and the 2 internal senses are very, very important, and the brain should be able to process and integrate all these senses. If these senses are not able to be integrated and processed by the brain, the child is going to be in a trouble. So as I already told you, the sight, the eye, hearing, taste, smell, and the touch, all these are the primary senses. The body position and the balance, that is the vestibular and the proprioception, are the 2 internal senses, and you therapists are working on these sensory, these 6 and 7 senses, to make them this child integrate. You must have heard that people are doing sensory profile. What is the sensory profile? How these sensory senses are reacting in the child. For example, an autistic child will have a good vision, but this child will not look into your eyes, have a fleeting eye contact. So that is because of the visual sensory processing problem. The child with an autistic spectrum will have a good hearing. If you do a BERA test, the child will have a good hearing, but it will not turn to your sound call. Name call response will not be there because the sensory integration or the sensory processing is absent with this child. Yes, a child with the autistic spectrum will not have all the food. The mother will complain that the child is not at all taking food. The doctor will think that, oh, this child needs some hunger medicine. The child needs worms medicine. But the doctor may not realize that this is a problem of sensory issue of the oral cavity. So the child will always, still even at 2 years of age, the child will take only porridge kanji or neatly or things which has been mashed only in the mixie. It will not take hard substances. So that is the problem with these children. So sensory issues and the sensory processing are also being done with our therapist. Or this is a sensory room, a good visualization of a sensory room which has got everything starting from your light, your visual stimulation, your auditory stimulation, your rocking tactile stimulation, everything is present in the sensory room. This is one another example of your sensory stimulation room where you have this trampoline and those things. And this is called as the sensory park, where you have the various colors are there. This is the floor with the various sensory substances being imported, being plugged into the floor, where when the child walks, this child will have a different sensory feel. So all these things should be part of your sensory diet. Sensory diet should be imported into the child with the sensory problems. All these are because of you therapists who are well versed in this field and doing the good for these children. Early intervention in specific conditions are also there. For example, children with the language delay, what am I going to do? You should always teach these small points to the parents. You should always say less. Tell the children in short sentences. Don't give long sentences. Simplify your messages. Again, stress and stress. Emphasize the keyword. If you want to make the child learn apple, tell the word apple again and again. You have to exaggerate the tone of the voice you are talking. You should repeat again and again. You should speak very slowly. Speak slowly. Lord, don't talk very fast and make the child understand. The child will not be able to understand. You should show familiar objects. If you want to make the child learn apple, you should show the apple and then ask the child to learn. So this is the 4 Yes. Say less, stress again and again, slowly say, show and say. So all these are the important pointers to make the language understand. Early intervention, very important in autistic spectrum disorder. Developmental and behavioral approach should begin very early, because behaviorally the child needs to be intervened. Then only you will be able to have a full functional child. Early stimulation in India, overall Indian scenario, opportunities, as I already told you, you must have in our small age groups, we must have played all these things. So this is a very important play, very common play in our villages. So this is one which improves. You must be seeing this is a very small game or something like, but this is one which will improve your fine motor coordination, your fine grip coordination, and also your visual motor coordination. So that is called as the Palanguli in Tamil Nadu. And this is the what I say, your top spinning of the top. That also improves the fine grips and your visual motor coordination. This is playing the gilly. All this also improves your visual motor coordination. This is playing what I say, chadu. I forgot the name of that. So if this play also improves your balancing and your sensory inputs, and all these opportunities were before there, but because of the urbanization, these opportunities are not being there now. Social activities are not there because many apartments have come. Many parents have shifted to apartments and urban areas, and these plays are not being played by our children. So opportunities have come down. As I already told you, auditory and language stimulation. So auditory stimulation, previously you must have seen most of our children will be given this anklet with a lot of money. So they will produce a lot of sound when the child walks, and this will act as a stimulation to the ears. Now it has become fancy. a 24 karat gold is a thin 24 karat gold is made as an anklet, which is not being produced sound. Previously, mother was there with the child 24/7. She will talk in her own language to the baby, which will stimulate the baby. There will be the grandmother in the family who will sing lullaby songs whenever the child wants to go to sleep. Now it is not there. Now it is a rocking chair which is doing the job for the baby. In the same family, there will be about 30, 40 members. Everyone will play with the child. Socialization opportunities are there. Now it is a nuclear family. Only the father, mother, and the child are there. So social activities, social stimulation, language stimulation are not there. So you don't mistake this. This is the reality in India. In the children between the 3 to 6 years age group, even though CDC says, world statistics say it is 1 in 59 autistic spectrum, in India the statistics is 1 in 125. So it is our job to find these children very early and do the intervention for these children. Why, if you take a classroom, if you take a school of 1,000 children, you will be able to find out 8 children with autistic in the autistic spectrum. Visual impairment is also there. Hearing impairment is also there. This is a census statistics. Lakhs and lakhs of children are there with visual impairment, hearing impairment, movement problem, speech problem. Who are going to help these children? It is we whom we are going to help these children. Early intervention program is always helpful for these children. It is our duty to help these children. So this is sorry. So if you do and help these children, see, this is one video which shows that how this therapy center is being monitored. I visited the center a few years ago and I was good morning. Good morning, how this poor setup is a very rural area, and how mothers are being trained by these therapists to do the therapy and helping these children. Even though they don't have the proper money at the setup, they are doing the maximum. So setup is not the primary thing, money is not the primary thing, space is not the primary thing. If you have the mind and will, you can do whatever changes you can bring in the children. So finally, our aim will be to focus on these F words. What are the F words in neurodisability? You should bring them the function in these children. Whatever the function you are able to produce, whether the child is able to study it in a normal school, whether they able to study in an inclusive school, whether the child is able to study in a special school, at the end of 15 years, what this child is going to be. Whether the child is going to sit in a telephone booth, or whether the child is going to sit in a cashier counter, or whether the child is going to study engineering is very important. It is you whom you are going to do the maximum therapy and making the child functional. Family, that is very important. A mother or the father cannot be in the home alone to take care of the child. The family has to go for the work. So the family has to be happy with this child. So you should do the maximum to improve the happiness of the child. Fun for these disabled children. You should make a group so that this child will also have a fun. For example, if you make a group of autistic children and all these autistic children come together on a day, they will have the fun. And fitness, that is also very important. You should teach the mother what are the physical activities these children can have, these developmental delay can children. Friends, they have their own peer group, and the future is very important. All these efforts can be made true if we people working in this area of developmental disability can do the miracle, do the early intervention, pick up these children in the early stage itself and do the time. A stitch in time saves time. Solving the problem right away will prevent it from getting worse and more difficult with the later. So that is the thing. And we all should give a safe hand to the baby who is born in this world. Thank you, friend, for this opportunity. And I am there to clarify your doubts. So this is the center which I am part of, that is DSOL Child Development Center. And we are doing this work with the help of youth therapists who are working in various fields of occupational therapy, physiotherapy, speech, special education, and behavioral intervention. Thank you. Hello.
Thank you, doctor.
Yeah.
Okay. I like to thank. Okay.
Any questions, Anid? I am ready to take Avanya.
Yes, doctor. Jonathan?
Yes, ma'am.
Any questions?
Not yet, ma'am.
Okay. Then we can do that vote of thanks. Anyone interested to ask the questions? I think no answer, no questions.
Ma'am, in the chat box, ma'am, can you suggest some activities for 22 years old autism person?
Okay, so that is an fully established autistic child. Without knowing the capacity of this person at 22 years, we will not be able to say what activities this child, because this person, this 22-year-old adult, can be good in some aspect, some area, and some area he will not be better. So knowing his capacity, his strength and weakness, then only we'll be able to say his activities can be told. What are the activities? If he is very good in painting, he can be trained towards good for an paint to go ahead with the painting schedules. If he's good in making some good artistic things, then he can be trained and tuned to do these artistic things, and this can be exhibited or made an income for that person. Thank you, Lavanya. It was a nice evening to share with you all. I hope this talk must have been useful to you
Yes,
people.
doctor, yes.
If there are any few talks on specific things, if you want to be dealt also, I can deal, because I am not able to understand what, because I can find this is a mixed group of students and senior occupational therapists also who are working in the field. So probably it will be very basic for people who are already working in this field. But I want to concentrate on all these, all the same group which you have, because you have mentioned 5 groups of people are there in the invite. So I have tuned my talk to cover all those people. Thank you for the opportunity.
Thank you, sir. It's okay, sir. On behalf of my OT team, I convey my regards and heartful thanks to our esteemed speaker, Dr. Somasundaram, sir, who spared time us to grace this occasion, who shared the knowledge with us. Would like to extend my thanks to all the participants for being with us. And thank you one and all. Thank you the technical team and students for the continuous support. Thank you so much. Thank you one and all on behalf of team OT. Have a great to all. We'll back with a new next seminar with delightful topics, and thank you all. Thank you, doctor. Thank you so much for spending the time with us.
Thank you. Thank you, everyone. Thank you.
Thank you, sir.
Sir, can I enter session, sir?
Yes.
Okay.
Close the session.